I've been here now in practice for over 20 years. And for almost 20 years at the Cleveland Clinic, where we've really established the premier center for men's health and sexual medicine and surgery. It was important for us to understand that sexual dysfunction is really a couple's problem. And our patients basically are men and women, oftentimes come in sometimes together, sometimes as couples. We see couples from same-sex marriages and relationships that have difficulty with sexual function, sometimes problems with fertility, sometimes problems with hormonal dysfunction, androgen insufficiency, low testosterone. These types of problems are very prevalent. 50% of men over the age of 40 have some degree of sexual dysfunction, and the numbers are even higher in women. So we see these people, and we try to understand the underlying problem, and we have a very basically state-of-the-art diagnostic center where we can help them understand the problem and then look at solutions to fix the problem. When patients first come to see us at the Cleveland Clinic, they realize they're at a world-class center that's really focused on their problem. I think they get a very comprehensive evaluation, including a history, certain diagnostic testing, and then really a really thorough degree of options that they can then select that are appropriate for them to fix their problem. Patients, I think, understand that sexual dysfunction, especially erectile dysfunction, can often be the first sign of other underlying problems. So I think they really understand what we're driving at, how we're attempting to understand their problem and offer them a solution. Our patients learn over time that they're not alone. These are very common problems, and there's always a cure. There's always a treatment option that will be appropriate for them. There's no one treatment that's right for everybody or every couple, but we can always find a treatment that's going to be appropriate for that couple. And I think that's the important thing that we try and get across to our patients.